Hello and welcome. Today, we're diving deep into a common yet complex condition affecting the kidneys: renal calcification, often referred to as kidney stones or nephrolithiasis. We'll explore what it is, why it happens, how to identify it, and what can be done about it. So, let's get started on our journey to understand this prevalent urinary system disorder. So, what causes these troublesome stones to form? The etiology of renal calcification is multifactorial, meaning it arises from a combination of factors. The most prominent cause is a lack of sufficient fluid intake, leading to concentrated urine. This allows minerals like calcium, oxalate, uric acid, and struvite to crystallize. Dietary factors also play a crucial role, with high intake of sodium, animal protein, and oxalate increasing the risk. Certain medical conditions such as hyperparathyroidism, renal tubular acidosis, and inflammatory bowel disease can also predispose individuals to stone formation. Furthermore, some medications, including certain diuretics and antacids, can contribute to the development of renal calcification. Genetic predisposition is also a factor, meaning if your family members have a history of kidney stones, you're more likely to develop them as well. Now, let's understand how renal calcification develops, focusing on the pathophysiology. It begins with supersaturation of the urine with stone-forming substances. Imagine a glass of water where you keep adding sugar. At some point, the sugar won't dissolve anymore, and crystals will start to form. A similar process occurs in the kidneys. When the concentration of minerals exceeds their solubility, they begin to crystallize. These tiny crystals can then aggregate and grow, forming larger stones. These stones can then become lodged in the kidney, ureter, or bladder, causing obstruction and inflammation. The obstruction leads to increased pressure within the urinary system, resulting in pain. The inflammation caused by the stone's presence further exacerbates the symptoms. Renal calcification is a widespread issue, affecting a significant portion of the global population. The exact epidemiology varies depending on geographic location, age, sex, and ethnicity. In general, kidney stones are more common in men than women, although this difference narrows with age. Caucasians are more likely to develop kidney stones than African Americans. The prevalence also increases with age, peaking between 40 and 60 years. Certain regions with hot and dry climates tend to have higher rates of renal calcification due to increased dehydration. Obesity, diabetes, and metabolic syndrome are also associated with an increased risk of developing kidney stones. It's estimated that around 1 in 10 people will experience a kidney stone at some point in their lives. The signs and symptoms of renal calcification can vary depending on the size and location of the stone. Small stones may pass unnoticed, causing no symptoms at all. However, larger stones that obstruct the urinary tract can cause excruciating pain, often described as the worst pain imaginable. This pain, known as renal colic, typically starts in the flank and radiates down to the groin. Other common symptoms include hematuria, which is blood in the urine, nausea and vomiting, frequent urination, painful urination, and urinary urgency. If the stone causes a urinary tract infection, symptoms like fever, chills, and severe pain may also be present. It's important to seek medical attention if you experience any of these symptoms. Diagnosis of renal calcification typically involves a combination of medical history, physical examination, and imaging studies. The doctor will ask about your symptoms, medical history, and family history. A urine test or urinalysis is performed to check for blood infection and crystal formation. Imaging studies such as a KUB, a kidney, ureter, bladder, X-ray, ultrasound, or CT scan are used to visualize the stones and determine their size and location. A CT scan, particularly a non-contrast helical CT scan, is often the preferred imaging modality due to its high sensitivity in detecting even small stones. Blood tests may also be performed to assess kidney function and measure levels of calcium, uric acid, and other minerals. Renal calcification can be classified based on the composition of the stones. The most common type is calcium stones, which account for about 80% of all kidney stones. These are further subdivided into calcium oxalate stones and calcium phosphate stones. Other types include struvite stones, which are often associated with urinary tract infections, uric acid stones, which are more common in people with gout or high uric acid levels, and cystin stones, which are rare and occur in people with a genetic disorder called cystinuria. Knowing the type of stone is important because it can guide treatment and prevention strategies. Treatment and management of renal calcification depend on the size, location, and composition of the stone, as well as the presence of symptoms. Small stones may pass spontaneously with increased fluid intake and pain medication. Alpha blockers, such as tamsulosin, can also be prescribed to relax the ureteral muscles and facilitate stone passage. For larger stones that do not pass on their own, more invasive interventions may be necessary. Extracorporeal shock wave lithotripsy, or ESWL, uses shock waves to break the stone into smaller fragments that can then be passed. Ureteroscopy involves inserting a thin, flexible tube with a camera into the ureter to visualize and remove the stone. Percutaneous nephrolithotomy, or PCNL, is a more invasive procedure that involves making a small incision in the back to access the kidney and remove the stone. Surgery to remove the stone is rarely needed. Prevention is key to avoiding recurrent renal calcification. The cornerstone of prevention is adequate fluid intake, aiming for at least 2 to 3 liters of water per day. Dietary modifications can also help, such as reducing sodium intake, limiting animal protein consumption, and avoiding foods high in oxalate, such as spinach, rhubarb, and nuts. Depending on the type of stone, specific dietary recommendations may be given. For example, people with uric acid stones may be advised to limit purine-rich foods like red meat and seafood. Certain medications, such as thiazide diuretics for calcium stones or apyranol for uric acid stones, can also be prescribed to reduce the risk of stone formation. Regular monitoring and follow-up with a healthcare provider are important to ensure effective prevention. The prognosis for renal calcification is generally good, especially with appropriate treatment and prevention strategies. Most stones can be successfully treated, and recurrent stone formation can be minimized with lifestyle modifications and medications. However, untreated or recurrent renal calcification can lead to complications such as chronic kidney disease, urinary tract infections, and kidney damage. Recent research is focused on developing new and less invasive treatment options, as well as identifying genetic risk factors for stone formation. Nanotechnology and targeted drug delivery systems are also being explored as potential future therapies. Understanding the mechanisms underlying stone formation will pave the way for more effective prevention and treatment strategies, ultimately improving the quality of life for individuals affected by this common condition. Thank you for joining us on this informative journey into the world of renal calcification.